Struggling with prostate issues? You're not alone. Millions of men experience problems that affect their daily lives, often without realizing the cause. From frequent trips to the bathroom to lingering discomfort, these issues can sneak up fast. But what if you could spot the warning signs early? Stay tuned as we uncover the 5 most common prostate health problems and what you can do to avoid them. First, we have alcohol. Alcohol is a common yet overlooked factor in prostate health issues. Many men consume alcohol regularly without realizing its impact on their prostate. Studies show that excessive alcohol consumption can contribute to prostate enlargement and inflammation, leading to discomfort and urinary problems. While occasional drinking may not cause immediate harm, long-term and frequent alcohol use can gradually increase the risk of prostate diseases, including prostatitis and even prostate cancer. One of the key reasons alcohol affects the prostate is its inflammatory nature. Alcohol triggers an immune response in the body, leading to increased inflammation. Chronic inflammation is a known contributor to prostate problems, as it can lead to swelling and irritation in the prostate gland. This can result in symptoms like frequent urination, difficulty emptying the bladder, and discomfort in the pelvic area. Over time, prolonged inflammation weakens the prostate and makes it more susceptible to serious conditions. Another way alcohol affects prostate health is through hormonal disruption. Alcohol consumption interferes with testosterone and estrogen balance, which plays a crucial role in prostate function. Studies suggest that alcohol can lead to lower testosterone levels while increasing estrogen levels, which may contribute to prostate enlargement. An imbalance in these hormones can also influence the development of prostate cancer cells, making excessive alcohol intake a potential risk factor for more severe prostate conditions. Next, we have dairy products. Dairy products are a staple in many diets, but they can have a significant impact on prostate health. Research suggests that consuming high amounts of dairy, especially milk and cheese, is linked to an increased risk of prostate enlargement and prostate cancer. Many men consume dairy daily without realizing its potential effects on their prostate. While dairy provides essential nutrients like calcium and protein, excessive intake can contribute to inflammation and hormonal imbalances that negatively affect prostate function. One of the main reasons dairy affects prostate health is its inflammatory properties. Dairy products, particularly those high in saturated fats, can trigger chronic inflammation in the body. Inflammation is a key factor in the development of prostate issues, as it can lead to swelling, discomfort, and urinary problems. Some studies suggest that men who consume large amounts of dairy have higher levels of inflammatory markers, which may contribute to conditions like benign prostatic hyperplasia, BPH, and prostatitis. Hormonal disruption is another major concern with dairy consumption. Dairy products contain natural hormones, including estrogen and insulin like growth factor 1, IGF-1, which can influence prostate health. IGF-1 is known to promote cell growth, and high levels of this hormone have been linked to an increased risk of prostate cancer. Additionally, consuming dairy may reduce testosterone levels while increasing estrogen levels, creating an imbalance that can contribute to prostate enlargement and other related issues. Calcium overload from excessive dairy intake may also play a role in prostate problems. While calcium is essential for bone health, too much of it can suppress the production of vitamin D, a nutrient that helps regulate cell growth and protect against prostate diseases. Some studies have found that men who consume large amounts of dairy, particularly milk, may have lower vitamin D levels, which could contribute to an increased risk of prostate cancer. A balanced intake of calcium from plant-based sources may be a better option for maintaining both bone and prostate health. Next, we have fried foods. Fried foods are a common part of many diets, but they can have a serious impact on prostate health. Many men enjoy fried foods like French fries, fried chicken, and potato chips without realizing the risks they pose to their prostate. Studies suggest that a diet high in fried foods is linked to an increased risk of prostate enlargement and even prostate cancer. The high levels of unhealthy fats and harmful compounds in fried foods can lead to inflammation, oxidative stress, and hormonal imbalances that negatively affect prostate function. One of the biggest concerns with fried foods is the presence of unhealthy trans fats. These fats are formed when oils are heated at high temperatures, and they have been linked to chronic inflammation in the body. Inflammation is a major contributor to prostate problems, leading to swelling, discomfort, and urinary difficulties. Consuming too many fried foods can keep the body in a constant state of low-grade inflammation, making the prostate more vulnerable to diseases such as benign prostatic hyperplasia, BPH, and prostatitis. Fried foods also contain harmful compounds called advanced glycation end products, AGEs, which are formed during high-heat cooking. AGEs contribute to oxidative stress, a process that damages cells and tissues, including those in the prostate. Oxidative stress weakens the prostate's natural defenses and increases the risk of abnormal cell growth, which is a factor in the development of prostate cancer. Over time, excessive consumption of fried foods can accelerate aging and cellular damage, making it harder for the body to fight off disease. Another problem with fried foods is their impact on hormone levels. Many fried foods are cooked in vegetable oils that contain high amounts of omega-6 fatty acids. While omega-6 is essential in small amounts, an imbalance between omega-6 and omega-3 fatty acids can contribute to inflammation and hormonal disruption. This imbalance can lower testosterone levels while increasing estrogen levels, which may lead to prostate enlargement. Unstable hormone levels can also promote the growth of prostate cancer cells, making dietary choices even more crucial for long-term prostate health. Next, we have processed meats. Processed meats are a common part of many diets, but they can have serious consequences for prostate health. Foods like bacon, sausages, hot dogs, and deli meats contain preservatives and additives that have been linked to an increased risk of prostate enlargement and prostate cancer. Many men consume processed meats regularly without realizing their potential harm. Studies suggest that a diet high in processed meats contributes to inflammation, oxidative stress, and hormonal imbalances, all of which can negatively affect prostate function. One of the biggest concerns with processed meats is their high content of nitrates and nitrites, which are used as preservatives to enhance flavor and extend shelf life. When consumed, these compounds can form nitrosamines, which are known carcinogens. Nitrosamines have been linked to various cancers, including prostate cancer. Frequent consumption of processed meats can expose the prostate to these harmful compounds, increasing the risk of abnormal cell growth and disease development over time. Processed meats are also high in saturated fats, which contribute to chronic inflammation in the body. Inflammation plays a key role in the development of prostate issues, leading to swelling, pain, and urinary difficulties. Diets rich in processed meats have been associated with higher levels of inflammatory markers, making the prostate more susceptible to conditions like benign prostatic hyperplasia, BPH, and prostatitis. Reducing intake of saturated fats can help lower inflammation and support overall prostate health. Another harmful property of processed meats is their high sodium content. Excessive salt intake can lead to dehydration, which thickens the urine and irritates the bladder and prostate. Additionally, high sodium levels can increase blood pressure and reduce proper blood flow to the prostate, affecting its ability to function optimally. Over time, poor circulation can weaken the prostate and make it more prone to infections and inflammation, further worsening urinary symptoms. Last, we have sugary drinks. Sugary drinks are a major part of modern diets, but they can have serious effects on prostate health. Many men consume sodas, energy drinks, and sweetened juices daily without realizing their impact on the prostate. Studies suggest that excessive sugar intake is linked to an increased risk of prostate enlargement and prostate cancer. The high sugar content in these beverages contributes to inflammation, insulin resistance, and hormonal imbalances, all of which negatively affect prostate function. One of the biggest concerns with sugary drinks is their ability to cause chronic inflammation. Excess sugar leads to increased levels of inflammatory markers in the body, which can contribute to prostate swelling and discomfort. Inflammation is a key factor in the development of conditions like benign prostatic hyperplasia, BPH, and prostatitis. Over time, frequent consumption of sugary beverages keeps the body in a constant state of low-grade inflammation, making the prostate more vulnerable to disease. Sugary drinks also play a role in insulin resistance, which has been linked to prostate issues. When the body consumes too much sugar, it struggles to regulate insulin levels properly. High insulin levels can contribute to hormonal imbalances and increase the risk of prostate enlargement. Some studies suggest that men with insulin resistance or diabetes have a higher likelihood of developing prostate cancer, making it crucial to limit sugar intake to maintain metabolic health. Another problem with sugary drinks is their effect on hormone levels. Excess sugar can lead to an increase in estrogen levels while lowering testosterone, creating an imbalance that negatively affects prostate health. Since testosterone plays a key role in maintaining prostate function, disruptions in this balance can contribute to the growth of prostate cells, increasing the risk of enlargement or abnormal cell development. High sugar intake also promotes oxidative stress, which can further damage prostate tissue over time,